So can old head injuries cause new symptoms? This is a great question, and actually one that's really important because we will see this very often where people will have a head injury that's a pretty significant one, and then they kind of move along, and then there's something dumb and little that just knocks them off the table. It's something that you see a lot, and the way to frame it in your mind is to consider how well your brain or your body can compensate for that problem. And if when we first had the injury, we can kind of compensate for it. It may not mean that the injury is actually solved, but you can just deal with it. But as you go through time, sometimes the ability to deal with that can start to degrade. So it's kind of like duct taping the problem together. You duct tape in your exhaust pipe. Over a period of time, though, that adaptation may start to fail, especially if we start to introduce new problems. If people become more sedentary, they start to have other health problems, diabetes, heart disease, maybe they take on more stress in their work, or they're just aging. These are very common things. We especially see these in former athletes that may have had an injury a long time ago, but as their health starts to deteriorate, they can no longer compensate for them, and then we see the symptoms show up. So if you're having symptoms and you're kind of hunting back in your life, looking for like, where did this come from? Sometimes there are things that come from way back, childhood level back, and it's just taken time for your body to kind of lose the ability to adapt. They start to deteriorate, and then the symptoms come out.